Thank you for allowing me to present our 12-month data on the use of a new device for the treatment of overactive bladder. This is a fully implantable neuromodulation device, and its size at 23 millimetres is about the size of a €1 coin, or locally slightly smaller than a 5 krona coin. This is implanted in the office under local anaesthetic, and it's placed over where the tibial nerve comes fairly close to the surface, 3 centimetres behind and above the medial malleolus. The incision, about 3 centimetres in length, is made above this again, so the incision's not sitting directly over the device. You see the device being pushed in there. It's easily put, once you've made the appropriate pocket, push down with the finger, incision closed in 2 layers. So with the study, patients were recruited who were refractory to medications. There was a washout period, and they completed a bladder diary, and as you see there, needed at least 3 incontinent episodes over the 3 days from urinary incontinence. Insertion was relatively easy, taking on average 17 minutes. And surprisingly, there was very little trouble with infection. The investigators could choose themselves whether or not they used antibiotics. And after 4 weeks healing time, the device was activated. It was designed to go off for 30 minutes every second day for the first 12 weeks, and then every 15 days thereafter, continuously on. Patients were reviewed initially monthly, then 3, 6, and 12 months with bladder diaries, questionnaires reflecting quality of life, and improvement scales. 46 patients were recruited across 2 countries and 7 centres, with mean age of 63 years, and a majority of them being female. They were quite a wet bunch, with 4 leakages a day on average. So it was pleasing to see that it became more of a dry bunch, with 12 patients becoming completely dry by the end of the 12-month study, and 66% of patients having at least 50% improvement. This was also reflected in their quality of life scores, and also where they placed themselves in the patient-reported global improvement. Surprisingly, 2 actually said they were worse at 3 months. We can't account for this, but by 12 months, they all said they were either the same or very much better, with the average score being 5.3. Mentioned the adverse event, and the patient who developed cellulitis to the wrapping that was placed around the ankle to help prevent movement of the device until it settled in place, and they had the device explanted, as did one other patient whose device did move, so it sat too posteriorly over the Achilles tendon. So in summary, this neuromodulation device showed durable efficacy over 12 months, was easy to insert, and patients tolerated it very well. Currently, the device is in a pivotal FDA study being undertaken at the moment before going to market. Thank you.
Well, when it comes to electrical stimulation, there are many factors that might influence the result. The reflex to be activated, the proximity of electrode to nerve, stimulation, frequency and pulse duration, etc., etc. But also stimulation time versus amplitude has a bearing. And my question is, why did you use such short treatment periods? Why not once every day or twice a day?
Well, you certainly could do as well, and that's other options. And it's always the problem when you first set up these studies is to trying to choose what you're going to do. The patient could feel it, and it needed to be done in a way that it wasn't going to interfere with what they were doing as well, or be annoying if they're in the middle of being involved in their work situation or whatnot as well. They didn't always get the timing quite right for it to be during a quiet time for them. And we think that's probably one of the reasons why there was slight worsening in results when they went on to every 15 days. And in the current study, it's actually being moved to be more frequent.
Questions, comments?
I have a question. Do you perform any kind of test before the implantation of the device?
Yeah, and some of the patients, though not all, so we haven't reported that, used a TENS machine for an hour a day for 7 days before the device was implanted. And that did seem to be predictive of whether or not they're going to respond to the implanted device. In the pivotal study being undertaken now, that is part of the study, and they'll be reported with those results.
Any other question from the floor? Francisco?
Francisco Cruz from Portugal. Can you recognize differences between patients that respond and did not respond to the stimulation? And the second would be increasing the length of stimulation every day could bring patients that did not respond to the situation of responders?
The second question first, maybe, but it did show that patients who had used the external stimulator for an hour every day for 7 days, the ones who didn't respond to that didn't tend to respond to this either. So maybe there is a group of patients who won't, regardless of how often you do it. And now I've forgotten the first question. Yeah. What was your other question, sorry? Oh, prediction, no. Yeah, there wasn't any other way of predicting. Patients who had leg edema were excluded. And it seemed to be if you were more than 1 centimetre away from the planned implant, ideal implant site, it also didn't work. But no patient factors as to severity or age or anything else.
Okay, thank you. Last short question and short answer, please.
Mike Ruggieri from Philadelphia. Is there any attempt to try to secure the device when you implant it so it doesn't migrate? It seemed to only happen in one of your patients, but I'm surprised it didn't happen in all of them.
No, you just tried to make the pocket appropriate size and then put a stitch above that to stop it from moving back upwards towards the incision site.